My name's Elizabeth.
And I'm going to be your nurse today.
Hi.
I just want to let you know that I have gone ahead and washed my hands, and we've closed the door to make sure
We have a private space for you. Can you tell me your name?
name and date of birth.
My name is Lawton Hilliard, and I was born on August 15th, 1999.
Perfect. Thank you. Today we're going to be
Doing a full head-to-toe assessment, testing all the regions of your body, your reflexes, your muscle strength,
and all of the above.
Okay, so right now I'm going to get a set of vitals from you, if that's okay. And we're going to start with your radial pulse. Awesome. So for your pulse, we got 75 beats per minute. And then for your respirations, we got 12 respirations a minute. So now we're going to move on from pulse and take your blood pressure. Make you slide up your sleeve for me.
Thank you. You're stuck. There we go. And if you'll hold those for me for a second.
And since I already took his radial pulse, I am just going to be starting with that and adding 30 to it. Okay, so for his blood pressure, I got 110/70.
So right now we're going to be
assessing your eyes. I'm going to start by checking your pupils and seeing if they're the same size, which they are. They look like they're about 3 millimeters, which is perfect. Next, we're going to check if they're equal, which they look nice and equal. We're going to check if they're round, which they are. There are no irregular borders. Next, we're going to check if they are reactive to light. So I'm going to take my pen light and I'm going to shine it into your eye. And the pupils constrict
normally, which is great. We're also going to
check how your eyes accommodate. So if you'll just look at the tip of my pen light. And the pupils constricted normally. as the pen light got close. Okay, so right now we're going to check your cervical lymph nodes. I'm going to be starting with the preauricular, which we can find in front of the earlobe. Okay, now we're going to do the postauricular, which is behind the ear. Are you feeling any tenderness?
Mm.
Okay. Now we are going to check the occipital. Okay, now we're going to check the tonsillar. Okay, now we're going to check the submandibular. Okay, and lastly we're going to check the submental. Did you notice any tenderness in any of those? Okay, so all of his nodes were of a normal size and there was no tenderness, so everything seems normal. Okay, so now we're going to look at your pulses. We're going to compare both sides and grade them. So I'm going to start with the carotids. Okay, and that feels normal, so I'd grade that as a 3+. I'm going to do his brachial next, which is on the inside elbow. Just slide your sleeve up. Okay, and that is normal as well. And that is normal as well, so we're going to grade those both 3+. Next, we're going to do the posterior tibial, which is behind the knee. Okay. Okay, and I would grade those both as 3+ as well. And lastly, we're going to do the dorsalis pedis, which is on the foot. So if you'll pop your leg up for me and put your foot down. Thank you. Okay, and if you'll swing your other leg up for me. Okay, great. So I would grade those both as 3+, and everything seems normal. So right now we're going to be assessing for any peripheral edema or swelling. So I'm basically just going to check down the legs and see if everything looks normal. There doesn't appear to be any swelling and there is no unevenness in the leg. Okay, so right now I'm going to be listening to the heart, and I'm going to be listening in 5 different points. We're going to start with the aortic valve. We're going to move to the pulmonic valve. We're going to listen to Erb's point, the tricuspid valve, and the mitral valve. I'm going to be starting with my diaphragm, and then we'll switch to the bell to listen for any bruits. So that sounded great. I didn't hear any murmurs or anything unusual. And now we're going to switch to the bell. And that sounds perfect. Okay, so next we are going to listen to the apical pulse, which is found at the apex of the heart. And typically you would listen for 60 seconds, but for the sake of time, we are going to listen for a couple seconds and determine if it is regular. that is regular. Okay, so next I'm going to be listening to the carotid artery in 3 separate places bilaterally with the bell to listen for any bruits. And that all sounds perfectly regular. Now we're going to move on to the thorax and the lung exam. I'm going to start by inspecting the thorax, so if you'll just put your shoulders back for me so I can get a good look.
And everything looks normal.
There's no sign of barrel chest. His chest looks completely normal.
We are now going
To listen
to your lungs.
from the anterior and the posterior sides
And listen
to
to
your lung sounds. So if you will take a deep breath in and out when I touch you with my stethoscope. Okay, and now I'm going to listen for behind.
Okay, awesome. So
Everything sounded normal. As for lung sounds, typically we'll hear the bronchial sounds in the trachea,
trachea and the larynx.
and these are harsher, high-pitched sounds. Then for the bronchovesicular, we'll see these in the bronchi of the lungs and the scapula. This is a more moderate noise. And in the majority of the lung field, we will hear vesicular noises, which are low and soft blowing noises. So we can hear those pretty much throughout the chest. We did not hear any adventitious sounds, no crackles, wheezes, or anything else that would be a cause for concern. Okay, so now we're going to move on to the abdominal exam. Firstly, you can lay down for me. We are going to assess the contour of the stomach, which looks normal, relatively flat. Next, we are going to auscultate the bowel sounds in the 4 quadrants of the stomach with the diaphragm to listen for the bowel sounds. Okay, so those are normal active bowel sounds. Next, we are going to percuss the abdomen. And what we're hearing is tympany, which should be pretty much throughout the whole abdomen, but you can hear other sounds like dullness if you are percussing over fluid or any sort of mass in the stomach.
If you'll sit up for me.
Next, we are going to do blunt kidney percussion at the costovertebral angle, which is
Found here in the back.
and check for any tenderness.
Is there any tenderness?
No.
Okay.
Is there any tenderness there?
Okay.
If we were to find any tenderness there, that could be indicative of some sort of kidney disease or malfunction.
So now if you'll lay down
For me one more time. We are going to palpate the abdomen now that we've already auscultated to see if we find any masses or any tenderness or anything out of the ordinary.
So I'm going to start with light palpation.
Are you feeling any tenderness?
Any
No.
pain?
Just light pressure.
Mm-hmm.
Okay, and now I'm going to press a little harder. And let me know if you feel
Anything?
Was there any tenderness? No. Okay.
So that feels completely
Normal. I didn't notice any masses or anything out of the ordinary. Okay, so now we're going to move on to the musculoskeletal exam. I'm going to start by having you stand up and walk across the room for me.
okay. Awesome.
And just walk right back. Perfect. And you can sit down.
So his gait and
Posture looked completely normal. His arms swung as he walked. He didn't shuffle. Everything looked normal. Now we are going to test your hip and shoulder range of motion. So we're going to start with your hips, if you'll stand up for me. And if you will move your leg outward from your body. Okay. And then you're going to pull it the opposite way into your body.
okay. Awesome.
So that is hip adduction and abduction. And those look perfectly normal, and that looks like full range of motion. So now we are going to do shoulder range of motion. So if you will hold your arm and place it in front of your body. Okay, and now you're going to do the same thing and switch it back. Okay, awesome. So it looks like full shoulder range of motion. So now we are going to rate muscle strength in your arms and legs. So if you'll just bring your knee up to me and press down or press up on my hand. Sorry, I'm knocking you off balance. Okay, and then do the same with your other. Okay, awesome. And then hold your arms out and then press up and then press down on me.
Okay. Awesome.
So muscle strength looks completely normal. I would grade that as a 4+. Okay, so now we're going to be testing several of your cranial nerves. We're going to start with your trigeminal. So if you will clench your teeth and bite down for me. Okay, so now we're going to be checking the acoustic cranial nerve using the tuning fork. Can you hear that equally in both ears?
Mm-hmm.
Okay. Great. Lastly,
We're going to be checking the spinal accessory nerve. So if you'll shrug your shoulders up for me. And then I'm going to ask you to do the same thing while I'm pressing down on them. Okay, great. So now we are going to check your deep tendon reflexes, and I'm going to start with the patellar tendon, which is found in the knee. There we go. Now we are going to be checking the tricep deep tendon reflex. So if you will hold your arm up for me.
thank you. And you'll just put your weight down completely in my arm. Okay. And we're going to find the tendon.
Perfect.